Hi there, my name is Doreen Guya and welcome to another episode of All About Life. And we are still tackling perimenopause. But right now I want us to talk about advocating for better workplace policies on insomnia and sleep disturbances during perimenopause in our workplaces. So insomnia and sleep disturbances significantly impact productivity, focus, and overall well-being. Yet, many workplaces fail to recognize menopause as a legitimate health concern. You see, advocacy for better workplace policy is crucial to ensure women don't suffer in silence. So what can we do? One, why workplace policy? Why does workplace policy matter? You see, perimenopause women are aged between as young as 35, but let's say 40 to 55, and they make up a significant portion of the workforce. Insomnia reduces productivity by impairing memory, concentration, and decision making. Women experience severe insomnia are more likely to take sick days, underperform, or leave the workforce early. You see, a lack of awareness leads to stigma, discrimination, and lack of support for affected employees. Statistics says that 1 in 4 women consider quitting due to severe perimenopause symptoms, including sleep issues. Perimenopausal women are the fastest growing workforce demographically. In many countries, only 10% workplaces have menopause or perimenopause specific policies. Can you imagine? Only 10%, despite it being a major productivity issue. Let's talk about workplace changes that can help. Number 1, implementing perimenopause/menopause friendly policies. You see, employers should introduce policies that recognize perimenopause as a health issue affecting work performance. This includes 1, flexible work hours. Allow remote work or adjusted start times to accommodate sleep disturbances. Offer split shifts or compressed work weeks. The second thing that can be done is perimenopause or menopause leave. Include perimenopause-related symptoms under medical leave policies. This is very important. Offer well-being days for managing severe symptoms. The other thing that can be done is wellness and sleep programs. Provide education on sleep hygiene in workplaces and stress management. Offer workplace wellness initiatives such as guided meditation sessions, and many more that you can come up with in your workplace. The other thing that you can do is temperature-controlled workplaces, access to fans, breathable uniforms, and ability to control office temperatures. Designated rest areas for short breaks. The other and final thing that you can do is insurance coverage for perimenopause and menopausal care. Include hormone therapy, sleep disorder treatments, and consultations with perimenopause/menopausal specialists in healthcare plans. All I have discussed can be easily achieved in our workplaces if employers take up the initiative and decide that women's health is important to them. How healthcare can educate workplaces on perimenopause and menopausal management. 1, employer awareness campaigns. You see, healthcare providers should collaborate with companies to educate the HR teams and leadership about menopause symptoms, all of them, not only insomnia, all the menopausal symptoms, and how they can help, or what companies can do to help the women workforce in their companies. Develop corporate training programs to help managers recognize symptoms and offer support. This will reduce stigma and frustration that comes with perimenopause and menopause. And actually, it will help a lot of women from leaving workforce early before their retirement time. Secondly, workplace screening and health clinics. On-site health assessment for sleep issues, hormone levels, and stress management. Access to occupational health nurses or perimenopause or menopause specialists in the workplace. This will be a game changer. This will be a game changer. The other one, the third thing, is partnering with insurance provider. Healthcare systems should advocate for insurance plans that cover menopause or perimenopause related treatments, including sleep disorder therapies, hormone replacement therapy, cognitive behavioral therapy for insomnia, and any other symptoms of perimenopause and menopause. The national guideline and workplace legislation. Governments and health organizations should develop national workplace for perimenopause and menopause policies similar to maternity policies. The same way we have maternity policies, the national government should develop national workplace perimenopause and menopause policy similar to that of maternity. Employers should be encouraged to offer perimenopause, menopausal friendly workplaces accreditation similar to diversity and inclusion efforts. The other thing that we can do in our companies, workplaces, is to encourage women to speak up. A lot of women are suffering in silence. They think they are abnormal. They think they might be sick. They think what they're going through is something that is shameful. So creating employee perimenopause and menopause support groups, safe spaces where women can share experiences and solutions. Have anonymous surveys, employers should gather data on how perimenopause impacts their workforce. This is a good one. Companies should really, really start by this. Do an anonymous survey and just find out how perimenopause and menopause is affecting the workforce. The other thing, training your HR on menopause and perimenopause awareness so women feel supported discussing symptoms. In conclusion, advocating for better workplace policies on perimenopause related symptoms, insomnia, and all others requires collaboration between employers, healthcare providers, and policymakers. By recognizing perimenopause and menopause as a workforce issue, companies can reduce stigma, boost productivity, and improve women's long-term career retention. Wow. How wonderful can that be? How wonderful is that? How great is that? So I hope that this information, you can use it to take it to your companies so that they can know how well to support the women workforce in relation to perimenopause and menopause. I hope this has been really educative and that you will take the initiative and do the best for your female workforce. Thank you. This has been All About Life by Doreen Guya. You can always subscribe, leave a comment, share, and like. Thank you.